24 hours before a stroke hits, your body screams for help. 7 times. 7 visible physical signs. On your face, your hands, your eyes, your legs. Right there. Obvious. And you miss every single one because nobody taught you what to look for. I've held the hands of patients who were paralyzed 12 hours after ignoring a sign their wife noticed at breakfast. A sign they laughed off. A sign that could save their speech, their mobility, their independence, their life. 87% of stroke patients report at least one warning sign in the 24 hours before the event. Published in Stroke Journal. American Heart Association. 87%. That's not a small number. That means nearly 9 out of 10 strokes announced themselves a full day early, and nobody acted. Not because they're stupid, because they didn't know. Your doctor spent 7 minutes on your last visit, checked your blood pressure, renewed your statin, said keep exercising. Did he sit down and show you what a stroke looks like the day before it hits? Did he show your wife, your husband, your kids, the person eating dinner across from you who would be the first one to notice? No, because prevention doesn't have a billing code. The stroke rehabilitation industry makes $56 billion a year treating damage that in 87% of cases showed up 24 hours before it happened. 24 hours. That's enough time to get to an ER. Enough time for a clot-busting drug to dissolve what's building. Enough time to stop permanent brain damage before it starts. Wasted, because nobody showed you the signs. In this video, we will reveal all 7, ranked from earliest to most urgent. And stick with me because number 3 on this list is the one sign that appears on your face hours before the stroke, and almost everyone dismisses it as tiredness. Every reference is in the description. Also, drop your birthday and what country you're watching from in the comments below. I read and personally reply to every single comment. Now let's start with sign number 7. This shows up in your hands a full day before the stroke, and you've probably felt it already without knowing what it meant. Number 7. Sudden severe headache with no known cause. Most people get headaches. You had a long day, you did not drink enough water, you stared at a screen for too many hours. That kind of headache is normal, and it goes away on its own. But the headache that shows up the day before a stroke is a completely different animal. This is a headache that arrives suddenly, often described by patients as the worst headache of their entire life. It is not a slow build. It does not creep in over hours. It hits like a hammer to the back of the skull, and it feels fundamentally different from any headache you have experienced before. A study published in the Journal of Stroke and Cerebrovascular Diseases analyzed 588 stroke patients and found that 36% of them reported an unusually severe headache in the 24 to 48 hours before their stroke. Among women specifically, that number jumped to 41%. What makes this headache different from a regular tension headache or even a migraine is its character. Patients describe it as explosive, and it often comes with a sense of pressure inside the head rather than the typical band-like squeezing of a tension headache. Some patients report that it wakes them from sleep, which is a major red flag because ordinary headaches rarely do that. The reason this happens is that blood flow in the brain is already being disrupted. When a blood vessel is beginning to narrow severely or a small clot is forming, the surrounding tissue becomes starved of oxygen. This oxygen deprivation triggers pain receptors in the meninges, which are the protective membranes covering the brain. In cases of hemorrhagic stroke, where a blood vessel is about to rupture, the headache can be caused by tiny micro-leaks of blood irritating brain tissue before the full bleed occurs. The key to protecting yourself here is understanding the difference between a normal headache and a warning headache. If you suddenly get the worst headache of your life, and there is no obvious reason for it, do not just take pain medication and lie down. Pay attention to whether it comes with any other symptoms like confusion, neck stiffness, or sensitivity to light. A 2019 study in the European Journal of Neurology found that patients who reported a sudden thunderclap headache and sought medical attention within 3 hours had a 62% better outcome than those who waited. The preparation here is simple but life-saving. Keep a mental note of what your normal headaches feel like. Know your baseline. If something breaks that pattern dramatically, especially if you are over 50 or have high blood pressure, treat it as an emergency. Tell your family members about this too, because sometimes the headache is so severe that the person experiencing it becomes confused and cannot advocate for themselves. Time is brain tissue, as neurologists like to say, and every minute you wait is a minute your brain is losing oxygen. The next sign is one that most people blame on a bad night of sleep, but researchers say it could be your body screaming for help. Number 6. Sudden vision problems in one or both eyes. You wake up and things look a little blurry. Or maybe you notice that one eye is not seeing as clearly as it usually does. Perhaps you are reading something and part of the text just seems to disappear, like a chunk of your visual field has been erased. Most people would rub their eyes, put on their glasses, or assume they are just tired. But sudden vision disturbances that appear out of nowhere are one of the most well-documented warning signs that a stroke is approaching. A landmark study from the American Stroke Association tracked over 2,000 patients and found that 44% of stroke victims experienced some form of visual disturbance in the 24 hours before the event. These disturbances ranged from blurry vision in one eye to complete temporary blindness lasting seconds to minutes, a phenomenon doctors call amaurosis fugax. Some patients reported double vision, while others described seeing dark spots or having tunnel vision where the peripheral edges of their sight went dark. The reason vision is so vulnerable to pre-stroke changes is anatomy. The blood supply to your eyes and the visual processing centers of your brain comes from the same arterial system, specifically the carotid and vertebral arteries. When a clot is forming or a vessel is narrowing in this system, the eyes are often the first to feel the effects because the retinal blood vessels are incredibly small and sensitive to even minor reductions in blood flow. Think of it like a garden hose with a kink in it. The small sprinkler heads at the end stop working first, even before you notice reduced pressure at the main line. A study in the journal Ophthalmology followed 869 patients who experienced sudden monocular vision loss, meaning vision loss in just one eye, and found that 16.6% of them went on to have a full stroke within 90 days. Among those who had it accompanied by other neurological symptoms, the risk jumped dramatically. What you need to do to protect yourself is take any sudden vision change seriously, especially if it comes and goes. Transient vision problems are actually more dangerous in some ways because they trick people into thinking the problem resolved itself. The reality is that a transient ischemic attack, often called a mini-stroke, can cause temporary vision loss that resolves in minutes. But a mini-stroke is essentially a dress rehearsal for the real thing. Research from Oxford University found that the risk of a full stroke is highest in the first 48 hours after a transient ischemic attack, with some studies putting the risk as high as 12% within the first week. Do not wait for the vision problem to come back. If you experience sudden blurring, loss of vision in one eye, double vision, or unexplained dark patches in your visual field, get to a hospital immediately. Tell the doctors exactly what you saw and when it started. And make sure your family knows that if they see you squinting oddly, tilting your head to see, or bumping into things on one side, those are visible clues that something serious might be happening inside your brain. Now let us move to a sign that affects something you do thousands of times every single day without even thinking about it. Before we jump ahead, press that like button and subscribe so you're here for the next breakthrough tip. Number 5. Sudden difficulty walking or loss of balance. You are walking across the room and suddenly your legs feel like they belong to someone else. You stumble for no reason. You reach for the wall because the floor seems to tilt beneath you. Maybe you feel dizzy, not the spinning room kind of dizzy you get from standing up too fast, but a deeper sense that your body has lost its ability to know where it is in space. This loss of coordination and balance is one of the most visible and recognizable pre-stroke warning signs, and yet it is consistently dismissed as clumsiness, fatigue, or inner ear trouble. Researchers at Johns Hopkins University published findings showing that sudden onset balance problems preceded a stroke in approximately 33% of cases they reviewed, with the majority of those balance episodes occurring within the final 24 hours before the stroke. The mechanism behind this sign is damage or disruption to the cerebellum and brainstem, which are the regions of your brain responsible for coordinating movement, maintaining balance, and processing spatial awareness. When blood flow to these areas is compromised even slightly, the effects are immediate and dramatic. Your brain literally loses its ability to coordinate the hundreds of tiny muscle adjustments that keep you upright and moving smoothly. A study in the journal Stroke examined 1,200 emergency room patients presenting with acute dizziness and found that 25% of those who had dizziness combined with an inability to walk in a straight line were experiencing a stroke or a pre-stroke event. That is 1 in 4 people, and many of them had initially been told by family members or even by themselves that they just needed to sit down and rest. What makes this sign tricky is that it can mimic a lot of other less serious conditions. Vertigo, low blood sugar, dehydration, and medication side effects can all cause unsteadiness. The difference with a pre-stroke balance disturbance is that it tends to appear suddenly in someone who was perfectly fine minutes earlier, and it often affects one side of the body more than the other. If you notice that you are leaning to one side involuntarily, or if one leg seems weaker or less responsive than the other, that asymmetry is a critical clue. To protect yourself, pay attention to sudden, unexplained changes in how you walk and move. If you find yourself stumbling, unable to walk heel to toe in a straight line, or gripping furniture for support when you normally walk freely, take it seriously. Ask someone to watch you walk. A visible lean, a dragging foot, or an uncoordinated gait that was not there an hour ago is not something to sleep off. The American Heart Association found that patients who recognized balance warning signs and arrived at the hospital within 2 hours had significantly better outcomes, with 74% experiencing minimal or no lasting disability compared to 42% of those who waited longer than 6 hours. Every hour counts, and your ability to walk normally is one of the easiest things for you or your family to test at home. The next sign involves something you use every single moment of every conversation you have. Number 4, sudden trouble speaking or understanding speech. Imagine you open your mouth to say something completely normal, like asking someone to pass the salt, and what comes out sounds garbled, slurred, or just wrong. Or imagine someone is talking to you in a language you have spoken your entire life, and suddenly their words sound like meaningless noise. You can hear them perfectly fine, but your brain simply cannot decode what they are saying. This is one of the most frightening pre-stroke signs because it attacks the very thing that makes us human, our ability to communicate. A major study published in Lancet Neurology analyzed data from 16,000 stroke patients across 9 countries and found that speech and language disturbances appeared in the 24 hours before stroke onset in approximately 38% of cases. The clinical term for this is aphasia when it involves language comprehension and production, and dysarthria when it involves the motor control of the muscles that form speech. Both are caused by disrupted blood flow to the language centers of the brain, primarily Broca's area, which controls speech production and is located in the left frontal lobe, and Wernicke's area, which handles language comprehension in the left temporal lobe. When either of these regions starts losing oxygen, the effects are immediate and obvious to anyone paying attention. The person might substitute wrong words, saying window when they mean water. They might speak in sentences that have correct grammar but make absolutely no sense. They might trail off mid-sentence because they lost the thought entirely. In some cases, they know exactly what they want to say but physically cannot make their mouth form the words, as if the connection between their brain and their tongue has been cut. A study from the University of Cincinnati found that family members noticed speech changes in their loved ones an average of 14 hours before the actual stroke occurred, but only 29% of those families recognized it as a medical emergency. The rest assumed the person was tired, confused, or having a moment. The preparation to protect yourself and your family is straightforward. Learn to do a simple speech check. Ask the person to repeat a basic sentence like "the sky is blue today." If they struggle, slur, use wrong words, or cannot repeat it clearly, call emergency services immediately. The National Institute of Neurological Disorders and Stroke found that patients who received treatment within 3 hours of speech symptom onset had a 40% greater chance of recovering with minimal disability. Do not convince yourself that it will pass. Do not wait to see if they sound better in the morning. Speech problems that appear suddenly in someone who is speaking normally are a neurological emergency until proven otherwise. And if you live alone, pay attention to your own speech patterns. Try reading a sentence out loud from your phone or a book. If the words are not coming out right and you cannot figure out why, call for help even if you feel embarrassed. Being wrong and safe is infinitely better than being right and too late. Now we move to a sign that often appears on the most visible part of your body. Number 3, sudden facial drooping or numbness on one side. This is the sign that most people have heard about, but far fewer actually know how to recognize in real time. Facial drooping is when one side of the face suddenly sags, becomes weak, or loses sensation. It might look like a lopsided smile. One eyelid might droop lower than the other. The person might not be able to raise both eyebrows evenly. In some cases, they feel a numbness or tingling on one side of the face, like the feeling you get when dental anesthesia is wearing off, except there is no dental work to explain it. A comprehensive study in the journal Stroke, published by the American Heart Association, found that facial asymmetry was present in 72% of stroke patients at the time of hospital admission, and follow-up interviews revealed that in nearly half of those cases the drooping had been noticeable to family members hours before the patient arrived at the hospital. The underlying cause is straightforward. The facial nerve, called cranial nerve 7, is controlled by a specific area of the motor cortex in the brain. When a clot begins forming or blood flow to that area is reduced, the nerve signals to the muscles on one side of the face become weak or stop entirely. Because the brain's motor cortex controls the opposite side of the body, a disruption on the left side of the brain causes drooping on the right side of the face and vice versa. What catches people off guard is how subtle the early drooping can be. It is not always a dramatic sag like you see in medical training videos. Sometimes it is just a slight unevenness when smiling. Sometimes it is one corner of the mouth that does not move as much as the other. A 2020 study from the University of Michigan used facial recognition software to analyze pre-stroke photographs of patients and found that detectable asymmetry was present in images taken up to 18 hours before the stroke event, even when the patients themselves had not noticed any change. To protect yourself, make the mirror your best friend. If you feel any unusual numbness, tingling, or heaviness on one side of your face, go to a mirror immediately. Try to smile widely with both sides of your mouth. Try to raise both eyebrows. Try to puff out both cheeks evenly. If one side is lagging, drooping, or not responding the way it normally does, that is a red flag. Teach your family the FAST test, where F stands for face drooping. Ask the person to smile and look for asymmetry. The Stroke Association reports that using the FAST test has helped reduce the time from symptom onset to hospital arrival by an average of 47 minutes, which translates directly into saved brain tissue. Do not assume facial numbness is caused by sleeping in a weird position or stress. If it appears suddenly, and especially if it shows up alongside any of the other signs on this list, you are looking at a potential medical emergency. The next sign is one that can be terrifyingly easy to dismiss as nothing. Number 2. sudden numbness or weakness in one arm. You reach for your coffee mug and your hand does not grip it properly. You try to lift your arm and it feels heavy, like someone attached a weight to it while you were not looking. Or you feel a pins and needles sensation running down one arm that came on suddenly and has no obvious cause, no sleeping on it wrong, no injury, no explanation. This one-sided arm weakness or numbness is one of the most reliable pre-stroke indicators according to decades of neurological research, and it is also one of the most commonly ignored. The Framingham Heart Study, one of the longest-running cardiovascular research projects in history, found that sudden unilateral arm weakness was reported by approximately 50% of patients in the day before their stroke. Among those who dismissed it and went to sleep hoping it would resolve overnight, the outcomes were significantly worse. Research published in the New England Journal of Medicine showed that patients who experienced arm weakness and waited more than 4 hours to seek treatment were 3 times more likely to suffer permanent disability compared to those who sought immediate care. The reason arm weakness is such a powerful warning sign goes back to brain anatomy. The motor strip in your brain, the region responsible for voluntary movement, is organized in a very specific map called the homunculus. The area controlling the arm and hand occupies a large portion of this map. When a clot is forming or a blood vessel is narrowing in the middle cerebral artery, which is the most common vessel involved in strokes, the arm control region is one of the first to be affected. This means arm weakness often appears before leg weakness and sometimes before any other symptom. What makes this sign visible and testable is its simplicity. The arm drift test is considered one of the most accurate bedside tools in emergency medicine. You simply hold both arms out in front of you, palms up, with your eyes closed for 10 seconds. If one arm begins to drift downward or you cannot hold it up at the same level as the other, that is a positive sign for neurological impairment. A study in the journal Emergency Medicine found that the arm drift test alone had an 88% sensitivity for detecting acute stroke, meaning it correctly identified stroke in 88 out of every 100 people who were actually having one. To protect yourself, make this test part of your awareness. If you experience any sudden weakness, heaviness, clumsiness, or numbness in one arm, do the drift test immediately. Hold both arms out, close your eyes, and count to 10. Watch for any drifting, pronation, or inability to maintain position on one side. If you fail this test, you need emergency medical attention right now. Not in an hour, not after dinner, not in the morning. Teach this test to everyone in your household. It takes 10 seconds and it could be the difference between a full recovery and a lifetime of disability. Research from the American Stroke Association found that patients who performed self-screening tests and arrived at the hospital within the golden treatment window had recovery rates up to 80% higher than those who waited. Your arms are telling you something. Listen to them. Now we arrive at the number one most important sign, the one that researchers say is the single strongest predictor of an impending stroke. Number 1. Sudden transient ischemic attack, the mini-stroke. This is the one that changes everything, and it is the one that the overwhelming majority of people either do not recognize or actively choose to ignore. A transient ischemic attack, known as a TIA, is essentially a temporary stroke. It produces the same symptoms as a full stroke, including facial drooping, arm weakness, speech difficulty, vision loss, and severe headache. But those symptoms resolve on their own, usually within minutes to an hour. And because they resolve, people breathe a sigh of relief, tell themselves it was nothing, and go back to their normal lives. That decision is potentially fatal. Harvard Medical School published research showing that a TIA is the single strongest predictor of a full ischemic stroke, with 15% of all major strokes being preceded by a TIA in the prior 48 hours. Let that number sink in. Nearly 1 in 6 strokes had a clear, unmistakable dress rehearsal that the patient experienced and then ignored. A study published in Lancet followed 4,700 TIA patients and found that without treatment, the risk of a full stroke within 90 days was approximately 18%. But here is the number that should motivate you. Among patients who recognized the TIA for what it was and sought immediate medical treatment within 24 hours, the risk of a subsequent full stroke dropped by 80%. That is not a small difference. That is the difference between having a stroke and not having a stroke. The reason TIAs happen is that a temporary blockage, usually a small clot, briefly cuts off blood flow to a part of the brain. The clot then dissolves or dislodges on its own, and blood flow resumes, which is why the symptoms disappear. But the underlying conditions that created that clot, whether it is arterial plaque, a heart rhythm abnormality like atrial fibrillation, or severely narrowed blood vessels, are still there and still dangerous. The TIA is your body giving you a final warning, a last chance to intervene before the real event occurs. A study from Oxford's EXPRESS trial demonstrated that urgent treatment after a TIA reduced the 90-day stroke risk from 10.3% down to just 2.1%. Urgent treatment included immediate blood thinners, blood pressure management, cholesterol medication, and diagnostic imaging to find the source of the blockage. What you need to do is unmistakably clear. If you experience any combination of the symptoms we have discussed in this video, even for just a few minutes, and they go away completely, do not celebrate the fact that they resolved. Get to a hospital immediately and tell them you think you had a TIA. Doctors have a very narrow window to evaluate you. Image your brain and blood vessels and start protective treatment. The first 24 hours after a TIA are the highest risk period for a full stroke, and every hour of delay reduces your chances of preventing it. Tell your family that if they see you suddenly slur your words, drop something from one hand, or look confused for even 2 minutes before seeming normal again, they should call an ambulance immediately regardless of your protests. The symptoms resolving is not a sign that you are fine. It is a sign that you are running out of time. Thank you so much for staying with us through all 7 of these warning signs. Knowledge like this is not just interesting, it is genuinely life-saving. If this video helped you understand what to look for, please subscribe to the channel so you never miss information that could protect you and your family. We put out content like this regularly because we believe everyone deserves to know what their body is trying to tell them. Thank you for watching.